Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here at Funcphysio Physical Therapy. Today I'm going to explain a possible connection between symptoms that seem like UTI symptoms that keep coming back and pelvic floor dysfunction. I see a lot of women in my clinic that report that they have had multiple UTIs in past year, or they have had UTIs that have not resolved even after antibiotics. Or they had to go in 2 or 3 courses of antibiotics and still have symptoms. So what's going on? An important thing that a lot of women don't know is that sometimes a pelvic floor dysfunction or a problem of tightness, spasm, cramping, poor function, poor coordination of pelvic floor muscles can present as UTI. It can mimic the symptoms that a UTI presents with. Okay, so to explain this, why it can happen, let's go over a little bit of anatomy. So basically, an infection is an inflammation of the tissue around the urethra. So if this is the bladder, which is sort of like a bag or a balloon filled with urine, there is a tube coming out of it from the bottom, which is the urethra, and that tube ends in the urethral opening. Now, the usual UTI is usually infection along this tube, some sort of microbial infection along this tube that irritates and inflames the tissue and keeps you from either holding, passing, or retaining the urine, okay, or gives you that burning, a feeling of burning, feeling of frequency, and difficulty holding urine or passing urine. Now, if we think about pelvic floor, there are tiny little muscles of the pelvic floor that wrap around this urethra as it comes down to become the urethral opening. So close to the urethral opening, there are few muscles that will form like a collar around this urethra. Some of these muscles actually hold urethra in place by inserting into the bones on both sides. So basically, there are these muscles that are forming collar or sometimes forming a sling around the urethra, the tube. When these muscles get too tight, or they get in a spasm or in a cramp, they have the ability to squeeze this urethra. You usually squeeze this urethra to hold your pee. Right? You're able to use these muscles to squeeze the urethra and hold your pee, and when you relax these muscles, you can pass the urine. But when these muscles are tight and they lose their regular flexibility, then instead of going through a cycle of relaxing and contracting, they often stay contracted or tight. And when they are contracted and tight around this tube of urethra, they do the same thing that a UTI tends to do. They irritate the tissue, they inflame the tissue, and they make it hard for the urine to pass. So sometimes, because these muscles are tight and squeezing the urethra, you'll have difficulty passing urine, you'll have burning and frequency, and just this constant discomfort around the urethra without a UTI. I very often see this, that women who have had a couple of UTIs still tend to have symptoms even though they don't have UTI, they don't test positive for any infection, and it's these muscles that are holding tight around the urethra or still have that residual sensitiveness from the UTI that happened before. So what's the takeaway? The first takeaway is, whenever you have a UTI or you think you have a UTI, make sure you get a urine culture. Okay, discuss with the doctor that even if you start the medication, you want to get a culture to see if you really had an infection. If the infection or whatever the symptoms are keep coming back and you are being given more antibiotic courses, then think with a suspicion, because if the infection is coming back again and again, it's possible that it's one of those deeply seated, hard to beat infections for which you will take antibiotics, but it's also possible that the symptoms are coming from elsewhere. So at that point, discuss with the doctor, have a little bit of suspicion about the symptoms. And if you test negative for UTI, then definitely go see a pelvic floor physical therapist, because we can work on these small muscles around the urethra, make sure they have good flexibility and good ability to relax and resolve your symptoms. This happens all the time, it's common, and you should seek physical therapy if that's something you need to do. Hope this helps.